Hi, I'm Lindsay from NextTech. In less time than it takes to complete most in-office procedures, we'll go over how you can reduce decision-making time, allowing you to optimize the overall appointment. We'll cover the past specialty history control, why it's important to your practice, how ophthalmologists are using it today, how to use the control within your patient's chart, and how admins can set up and customize it. You can now have access to your patient's full past specialty history within the chart. You no longer need to search old records or switch screens. Ophthalmologists who tested this feature in our early adopter program found it helped them make more informed decisions, resulting in improved patient outcomes. Whether you're performing injections or specialty procedures, the past specialty history control is designed to save time, enhance decision-making, and empower better patient outcomes. When you're managing patients with complex ophthalmic histories, whether they've had multiple IVT injections, advanced corneal procedures, or glaucoma surgeries, we know how crucial it is for you to have a clear, comprehensive view of their ophthalmic history. With the past specialty history control, you can now quickly assess which procedures have already been performed, when they were completed, and review other key aspects of the patient's medical background, such as their current diagnosis, specialty medications, and systemic history, right from within the chart. Let's walk through how to use the past specialty history control as a provider, scribe, or technician. We'll cover historical information, how you view and interact in the encounter, and how to add procedures and surgeries manually.
First, how do you view and interact with the past specialty history in the encounter? To view a patient's historical procedures and surgeries, go to the section in the encounter where the past specialty history control is enabled. This section will display past procedures, including the name, date, and provider who performed the surgery. Clicking on any procedure or the white space of the control will expand the section, allowing you to see more detailed information. If a patient has two or more of the same procedure name on the same location, the multiple procedure icon will display. Click this expand arrow to show procedures grouped by date, and extended history notes are added in this section and are visible across all procedures, surgeries, visits, and providers. How do you add procedures and surgeries manually? To manually add a procedure, expand the past specialty history control by clicking any summary bubble or the white space. From here, select the procedure you need to document. Please note, the list of procedures is based on the clinic and OR procedures available in your knowledge base profile. If a procedure isn't listed, you can type it manually into the yellow box at the bottom. Once you've selected a procedure, designate the location where it was performed. Next, fill in the date, provider, office location, and any comments. Provider and office location fields will show a drop-down list of practice providers and office locations. If the provider or office is outside of your practice, you can manually enter that information as well. Comments you add here are specific to the procedure and will only be visible when the procedure details are expanded. Manually entered procedures can also be deleted if necessary. After saving, the new procedure will automatically be placed in chronological order within the patient's history.
Now, let's walk through how, as an admin, you can set up the past specialty history control. We'll cover how to enable and disable, change the name, and how to add the past specialty history to reports and letters.
So first, how do you enable or disable the past specialty history control? To enable or disable the past specialty history control, go to the knowledge base section in the admin panel. From there, choose Configurable Chart. Select the profile and encounter category you want to edit. Then expand the section where you want the past specialty history control to appear. You can place it in either the History or PSFH section, but not both simultaneously. This is a profile-specific setting and will affect all charts created using a specific profile after the change is made. Use the toggle to enable or disable the control in the chosen section. Once enabled in one section, it will not be available in the other. Be sure to disable it in the undesired section before enabling it elsewhere. Be sure to click Save to apply these changes to all charts associated with that profile. How do you change the control name from past specialty history to past ocular history? If you want to change the control name from past specialty history to past ocular history, head to the Practice Settings section within Admin. Under IntelliChart Settings, find the checkbox to update the control name. Mark the checkbox and click Update. This change will apply to all users across your practice. Be sure to note that if you leave the box unchecked, the control will continue to display as past specialty history. How do you add the past specialty history to reports and letters? To add the past specialty history control to your reports or letters, navigate to Report Settings in the Admin section. Choose the doctor and report type you want to edit. Locate the Past Specialty History option in the Available Report Sections list and click the double arrows and add it to the Report Sections column. Once added, use the up and down arrows to move the section to your preferred position in the report. The section is set to false by default. If you want to make it visible in chart notes and patient summaries, change false to true. For letters, switching it to true will include the section automatically.
And there you have it. Time for you to implement the past specialty history control to save time, enhance decision-making, and empower better patient outcomes. If you have any additional questions setting up or using the past specialty history control, please reach out to our team by logging a ticket or messaging your point of contact here at NextTech. Until next time.